think about the dynamic of the Hispanic families in the sense that when a new family moved to the area, maybe in that dynamic, mom and dad are undocumented. A son is born in their home country, but then when the years go by, another kid is born here in the US. So we have a family of four. And the interaction for the family with the healthcare system, in first instances, it happened at the emergency room. When a new family come to the US, in most cases, depending on the situation, but they are escaping a rough reality in their home country, so they're not thinking about bringing their vaccination record with them. So there is no way that you can prove which vaccine was given to the child in their home country. We can assume, but you cannot assume which vaccine was given without that record. So when the family takes their sick child to the emergency room, then sometimes the question is asked, are the immunizations up to date? And the mom might say, maybe, I don't know. Because also mom doesn't remember if she has that vaccination record, or she doesn't remember which vaccine were given in their home country. But then the doctor at the emergency room say to the family, okay, you need to go to your primary care doctor, and then your kid need to be updated with the vaccines. If you don't have health insurance, the mom more likely is not going to be able to take the child to the primary care doctor to get the vaccines, because it's a financial burden. If you go to the doctor, you have fees. You have administration fee, you have the vaccine by themselves without insurance are extremely expensive in some cases. And families are not able to afford that, especially when it's a new family moving to the area, where the main needs is to take care of the housing, the food, and transportation. If you don't have health insurance, I think it would be very important that the emergency room understand that if you don't have health insurance and you want this family to connect with a primary care provider, what are the best options for them? If there is not a financial assistance application in place at the hospital, that means that the patient is responsible for 100% of the bill. And if we know that the family will not qualify for that financial assistance, then we need to move to the next option, which would be an FQAC, a federal qualified health center that offer discounted services to establish themselves with a primary care provider, independent of their immigration status. Then we also need to know what are the free clinics available in the area, because the process will be a little bit easier because there is no paperwork involved on going to a free clinic, which a lot of time facilitate that access to Hispanic families, because we have to remember that a lot of Hispanic families, they work for cash, so they will not have a pay staff, they will not have a tax return. So the less paperwork is involved, I think that kind of provide access to all the families. And if the emergency room can be that place to provide some of that information, I think the families will be better suited to follow up with their primary care provider, to have access to the vaccines, and to have someone in place that can take care of them. I think it's important to understand that dynamic in Hispanic families or dynamic of any immigrant family are completely different than the citizens, in the sense that maybe in a Hispanic family you have dad that has a work permit, mom is undocumented, a child is born in the US, another one was born in their home country. In that family, everybody qualifies for a different kind of insurance. We have to make sure that we connect them to the right place. And if the health department, the school, the emergency room understand that they have to connect those families and not just let them hang in, then the family is going to be in a better place.